sneakers, though? Who's got the best sneakers? Very quiet. She's like, there are kind of a lot of people here.
You know, you are just too gorgeous. You know, you are just too gorgeous.
So, sweetie, let me see. Look at that. Sparkly. Sparkly. Thank you. Look at that. You have the same jewelry. She's got a ring like that. Your bracelet. Just for you. What? Okay.
Oh, next to me.
Yes. Here, scoot over. And then. See, Dad wanted to come too. Is that good?
Yeah, I think he's been part of this journey.
Yeah.
As a matter of fact, I can't remember when I haven't seen him.
Yes.
So everybody, don't move down, but
The mic might be a little tough for us to work with, that distance.
What do you need? You want the table closer to them?
Should they hold it?
I maybe hold.
Like
Because it's,
low. Would they go low? Are you folks ready?
it doesn't,
I got one trying to figure out the microphone situation.
It doesn't.
Yeah, we're not.
It would have to be loosened if we're doing it then.
Hey, pull it forward.
Well, it's
Here, can
tape,
you,
so.
tape? Can you,
Yeah, if you just the tape under your foot so we can just pull it forward a little bit.
or the rug, just take the rug out.
Okay, so you gotta just plug that back in.
Yeah.
Guys.
I like the spark.
I cannot believe what an angel. There are no drugs on board?
Yeah, we're good. Everybody's good? 1 second.
Does Dr. Barakat need the mic first?
Yeah, do I hold it or what?
Yes.
Hold it.
Are we good?
So welcome everyone.
Okay, good. Everybody's good.
Close to everyone.
Yeah, why don't you sit, because if
Okay.
everybody's sitting,
Yeah. Plus the fact that I'm 8 feet tall, right? Good.
Yeah, yeah.
you said it.
Okay. Good morning, everyone. We'd like to welcome you all here today. My name is Richard Barakat. That's B-A-R-A-K-A-T. I am the physician-in-chief and the director of cancer for the Northwell Health Cancer Institute. And we're here today really to honor Breast Cancer Awareness Month. This is an extremely important month for us. As you know, breast cancer is a very common disease, especially on Long Island. And as you might imagine, having breast cancer is difficult enough. But we're here today with one of our patients, Jennifer, and her baby Marla, as well as her husband, who was diagnosed with breast cancer while she was pregnant. At one of the happiest times in a patient's life, in a couple's life, when they're having a baby, to be told that they're having cancer. The difficult decisions that have to be made during that time point. And we're so proud of the fact that Jennifer received her care here by Dr. Kostroff and Dr. Carlton, and was able to maintain the pregnancy, have the cancer treated, and ultimately deliver an incredibly gorgeous baby little girl. So she's the star today as her mom and her family, and thank you for being here today. Also, one of the things that we're able to do at Northwell Health is really provide the most comprehensive care for patients. And we launched last year the Center for Cancer, Pregnancy, and Reproduction. As a healthcare system, we deliver 40,000 babies a year, which is about 1% of all the deliveries in the United States. And about 1 in 1,000 women will have cancer diagnosed while they're pregnant. And what we wanted to do was make sure that we streamlined that care so we could guide patients through that difficult journey of not only being pregnant, but getting their cancer treated at the same time and ultimately achieving the best outcome, which is a healthy mom and a beautiful baby. So thank you for being here today.
My name is Karen Kostroff. I'm Chief of Breast Surgery at Northwell, KOSTROFF. In January of 2018, I met Jennifer, her husband Kevin, and her mom and dad. She was 30 years old at the time, married 1 year, and was 4 months pregnant, and had been just told that she had a breast cancer. With that came multiple decisions. She needed to be treated properly for her own health, for her breast cancer, but she also very much desired to continue her pregnancy and deliver her child. When I met her, the issues were, could we achieve that? Because of that situation, I had to involve additional physicians, a high-risk OBGYN who would care for her during her pregnancy and the baby, and a breast medical oncologist, Dr. Carlton. So we worked as a team to try to deliver comprehensive and ultimately very supportive care. She was amazing. She made the decision to move forward and embarked on chemotherapy for 4 to 5 more months, then delivered a healthy, beautiful baby girl, then breastfed, which is something she very much desires and is safe in a breast cancer patient. Then she underwent a double mastectomy with the first stage reconstructive surgery, and the reason she chose that and needed that was another factor. During this time, we had to determine why did Jennifer at age 30 have breast cancer, and she found out that she had the BRCA gene despite no family history of the gene. As it turned out, it came from her father's side. Fortunately, he and his brothers, although they have the BRCA gene, they have not had any manifestations of the disease, and their children actually have not had it passed to them. With that, she chose to move on to a double mastectomy for stage reconstruction, and then had additional chemotherapy, radiation, and additional surgery. And now what has been most amazing is this amazing girl with the support of an incredible husband and parents and an extended family has done what one can only and should do. Is you can change whatever bad news comes your way, but they have never, ever chosen to focus on what they couldn't control. Instead, they have focused on what they could control and put all their energy into getting optimal care for her sake, so she can be a mommy forever, a wife forever, and have a healthy baby girl. And with that, she is also willing to be the face of this difficult situation to show others the pathway of how this can be done. So with that, I'm going to pass it to Dr. Carlton, a medical oncologist.
I'm Jane Carlton, Carleton, and I'm the Associate Chief at Monterey Cancer Center, and I'm a breast cancer oncologist. Breast cancer is always a challenging disease, and women are filled with emotion when they get that diagnosis. But you can imagine, never is there more involved than when you're 4 months pregnant and you find that you have breast cancer. But the wonderful thing is we have so many options with how we treat patients that we were able to safely treat Jen, that she could have a healthy pregnancy, not compromise her cancer care, and deliver this gorgeous baby girl. So what this meant, when Jennifer first met me, we talked about all the options. And as crazy as it may sound, it is actually safe to give chemotherapy once a woman is past the first trimester of pregnancy. So she was 4 months pregnant. We did chemotherapy, and she was monitored by the high-risk OB physicians, and baby Marlo did beautifully throughout the pregnancy. And so did Mom. I mean, she was never there without her husband, without her parents. There was so much support. And you know, that is one of the things that is key about treating cancer. It's teamwork. It's all the physicians working together and the patient and community, family working together. And that's where the best care is delivered. So we're really excited to have this center here now because we can put that teamwork together and we can continue to bring this level of care to everyone who needs it. We hope that no one needs it, but when it happens, we can take care of people. And so seeing Jen today, as beautiful as ever with this wonderful baby girl, and we continue to talk about how to move forward. Jen is continuing to say, how do I incorporate all of these things that have happened to me into my life? And so we just met together this week and we're talking about the ongoing changes. You know, what does it mean to have gone through chemotherapy, to have surgery, and how do you keep moving forward? And Jen is an inspiration. She is always figuring out how to give back, how to make herself healthy and whole and well, but also to reach out to others. And she has been an inspiration to see what she has done with this. Thank you.
Thank you.
You gotta flip it over, yeah.
Hi, I'm Jennifer Murphy, and this is my baby Marlo and husband Kevin, and my wonderful doctors. And like they said, I wouldn't be here without my wonderful support and my amazing doctors. You know, I say mother 2 and 3 through the whole process. They held my hand. They were a shoulder to cry on when I needed. They supplied laughs when I needed them. They were there for me every step of the way. And it, you know, this journey has been crazy, for lack of a better word. I never thought that my first pregnancy would be filled with such excitement and such fear. And the fact that I'm sitting here today with hair and my daughter's 18 months old is just a miracle, because just like in January 5th, 2018, when I was diagnosed and I got that phone call, I didn't know if I had a future. I didn't know if there was happiness ahead. But because of everyone in this room and my family, I'm here today. And I have a beautiful daughter. And it is amazing that where science and medicine has gotten us today. And everyone that I speak to, and I say I was diagnosed at 16 weeks pregnant, and they say, you can't have chemo when you're pregnant, right? I mean, you can't have cold cuts and sushi, but you can have chemo. But it's a miracle, and I was able to do it. And there's this moment when I had a sonogram, and I was bald at the time, and we looked at the sonogram picture, and I said, what's that fuzziness? And my OBGYN said, that's your daughter's hair. And so at the same time that I was bald, she had a full head of hair. Yeah. So it's such a miracle. As my body was basically trying to kill me, I was also growing another human inside me. So a woman's body is just so amazing. And the fact that I've been through everything, 3 rounds of chemo, a double mastectomy, 25 rounds of radiation. I'll be on medicine for the next 10 years, and we'd love to have more children, but we don't know what's in our future. I'm here today, even though it's difficult, to be the face of anyone that is going through this right now, or that will go through this in the future. You can do it. You can keep your baby. And if a doctor says you can't, go to another. Like, you have to be your own advocate, and you know in your heart when something is wrong or when something is right, and be your own person. You know, I'm here to help other women, because when I was diagnosed, all I wanted to hear was from a woman that was going through the exact same thing and was on the other side of it, had a healthy baby, had a healthy pregnancy, and was doing well. So that's why it's so important for me to make sure that I remind these women that you can do this, you can fight this.
Marlo agrees.
So at the center that we established since last May for cancer, pregnancy, and reproduction, we've now had over 35 pregnant patients refer to us. So we really, as a healthcare system, can provide that incredibly comprehensive care. This is difficult, to take a patient who's pregnant and get them through chemotherapy and then have the baby delivered and have the baby do well. The other thing that we're establishing is a national registry to follow children who have gone through this, who have gone through chemotherapy during pregnancy, to see how they do in the long term and make sure that they don't have ongoing problems. So we're very proud of what we're doing as a healthcare system. We're proud to be able to give moms a chance, to give them hope that they can have a baby and get through this and make sure that they're doing well. And also in, the center will help counsel patients about having another baby in the future as well, because that is something that you might want to consider. So I think at this point, probably just open it up for questions. Or
one other aspect that you spoke of in terms of having another baby. Another aspect of the science that has advanced is if Jennifer and her husband choose to conceive again, they will be able to select the egg that does not have the BRCA gene. It's called prenatal genetic diagnosis. So the child that they will bring into the world, we can guarantee will not have this gene and be at risk for it. So an important aspect. Questions?
I do. I have a few. Do you mind if I ask them here, or you want me to do one-on-one?
No.
Okay.
Ask.
Excuse me. How rare is this? Can you speak to how rare this is? I know he said 35 patients. Have you yourself seen? I know you've been practicing for a long time.
Sure.
How rare is it?
It's very rare, fortunately.
Your mic and speak it.
Fortunately, it's very rare, but it can occur at any stage in the pregnancy, and each stage has different issues. Early on in the pregnancy, mid-pregnancy, and sometimes you choose to proceed with surgery first and then additional treatment afterwards.
if you look at national statistics, it's about 1 in 1,000 pregnant patients will develop cancer. And that's why, as a system that delivers 40,000 babies, we felt it was important to have this center, because we probably see about 40 or 50 pregnant patients with cancer a year. Breast cancer is the most common diagnosis during pregnancy and is often difficult to diagnose because of the changes that occur in the breast when someone is pregnant. Other cancers that can occur during pregnancy are lymphoma, some gynecologic cancers. We've seen patients with colorectal cancer. But really the critical point is to give patients the options, not to have a knee-jerk reaction that it's either mom or baby, but we can take care of both. And that's the important message that we want patients and their families to have.
What kind of symptoms was she showing, or if you gentlemen want to talk about, how you knew?
Yeah, I was actually on a trip in Italy with my mom and my grandmother, and I felt a lump. I was 4 weeks pregnant at the time that I did not know. I felt a lump, but in the back of my mind, I said, well, I don't have any breast cancer history. Nothing in the family. It can't be that. I'm sure I'll go to the doctors when I get back. And as I got back, I discovered that I was pregnant. And when I went to my OBGYN and brought it up, they said the first time, I'm sure it's just pregnancy related, milk duct clot. Don't worry about it. But in the back of my mind, I knew something wrong. And 4 weeks later, I felt 2 lumps underneath my armpit. And I said, something's wrong. And she even still said, well, I could be an infection. And I said, no, I want a sonogram, and let's get this checked out. And then, unfortunately, we had the worst news, yeah. But I was the one who found the lump, and that's why it's so important to be your own advocate. Because if I would have just listened to my OBGYN in the beginning and just of course I wanted her to be right. I wanted to say, okay, everything's fine, but I knew it wasn't, so.
One more question, sorry. Not to make you emotional, but you said in the beginning that you really didn't think like you were going to be able to see the outcome. Yeah.
I think because I didn't really have much experience with breast cancer or cancer itself, anytime you ever heard cancer, you thought, well, you can die from this. And I had no idea that you could be pregnant with cancer, so thought, well, that has to be worse. And yeah, I think the first few weeks were very hard. We didn't know. We didn't have a plan. We didn't know what was going to happen. We didn't know, was the chemo going to work? And it's a very stressful time that not only are you worrying about your life, but you're worrying about growing a human inside of you. And the fact that, a woman, your body could be turning on you at the same time as a wonderful growing a child inside of you is phenomenal. And I remember my brother-in-law got me this gift that you could hear the heart. And every night after chemo, I would go and just lay there silently and just say, please, let me hear the heart. And every time I did, I said, okay, we can do this. We can keep moving forward because she's good. And that I'll remember because it was such a special moment. It was just me and in the room alone. And every time I heard that, it was like she was fighting with me. She was there with me every time, along the way. So, yeah.
What stage was the cancer?
Oh, yeah, go ahead.
You're welcome to answer, but, Jennifer. So it was stage 2. And as Jen mentioned, she felt the lump, but then she also felt the lymph nodes. And so it was stage 2. But one of the things is that we didn't know until afterwards for sure that it was only stage 2 because, of course, we couldn't do a CAT scan or anything else while she was pregnant. So, again, kind of crazy, right? That you can give chemotherapy, but you can't have an X-ray. So, but that's what we did. We did the chemotherapy. We were able to monitor the cancer and see that it was shrinking. And then after she delivered the baby, then we were able to get a CAT scan and a bone scan. We had a little bit of a scare then because we saw a little bit of uptake in the bone. Now, it turned out it was just because we had given her what we call growth factor to keep her blood counts up during the chemotherapy, and it stimulated the bone. But we were all just terrified for a little while that perhaps the cancer had spread. But we did a biopsy of the bone and were able to show that the cancer had not spread. So it was stage 2 in the breast and in the lymph nodes, and then it shrank with the chemotherapy, was smaller at the time of surgery. And then she's continuing on what we call endocrine or hormonal therapy because it was a typical breast cancer, hormone sensitive. So we have a lot of drugs that we can treat in the long run. And that's why, of course, it's a long time to treat, 10 years. But the interesting thing is, after we're at least 2 years out, that's when we might take a little break from the hormone therapy so we can use fertility drugs, harvest eggs, and then be able to plan a pregnancy, and then back on the medicine. So,
I just want to make one comment. Dr. Kostroff is an outstanding surgeon, and Dr. Carlton is an incredible medical oncologist, and they're both extremely humble because they act like they just took care of this like it was nothing. To operate on someone who is pregnant is very complicated. There are important considerations from anesthesia, and to give chemotherapy like, we just gave chemotherapy. These are difficult drugs to give, and everything changes in pregnant patients. The rate that they filter drugs through their kidneys change. So this wasn't like, we just gave chemotherapy, and this was very complicated. And it is by putting together an incredible team of surgeons, medical oncologists, obstetricians, working together with the patient and her family, making sure that everything is okay, that you get a great result. And we're so proud of the fact that we are being known as the center that can really help pregnant patients who have cancer to get them through this process. I think somebody should ask Kevin a question because he's been patiently sitting here. What's it like to be the dad going through this all, Kevin?
I mean, quite honestly, I just followed Jen's lead. It was very difficult, but she was so positive throughout, and woke up every morning with a smile on her face and said, we're just going to have a good day today. And she'd come in here. I'd be scared, but she'd be smiling and ready to go to treatment and ask Dr. Carlton 2,000 questions every time. But honestly, you were the rock that I just followed your lead.
I don't know if this is a little too personal. My science might be wrong, but I apologize, but the BRCA gene, don't women often have to get their ovaries out too? And is that part of why you said you weren't sure about? And if it's too personal, you don't have to answer.
Well, let me just comment from the medical point of view. Yes, the BRCA gene puts women at increased risk for breast cancer and ovarian cancer. And so we do recommend bilateral mastectomy, which Jen did. But then we do recommend removing the ovaries after a woman has completed childbearing. So I actually have a patient who is BRCA positive, and she was diagnosed when she was, before she was even married. We did her treatment, and then she got married. She went off her therapy, had baby 1, went back on her hormonal therapy. Then she was ready for baby 2, and so she continued her life. Now, she had her ovaries out when she was only 34 because she had said, I have 2 children and I'm done. But with Jen, we have to give her time. And we know that we can safely do that. So when the time comes, we'll remove the ovaries. But we don't have to do that right now. So we'll be monitoring her and making sure she's okay.
Did you know you were having a girl, or was the sex a surprise?
I did know.
Yeah, I did know. We found out days before I was diagnosed. Yeah.
That was the end of December.
Yeah, so we found out. I think we went, because I had the biopsy on Monday, and we went to the OBGYN that day to find out the sex, and then I found out that Friday that I was had breast cancer. Yeah, so actually, the day I got the biopsy was the first time I felt her kick. Literally, they put the needle in, and she kicked. And I was like, okay, we got this. We're doing this together. So every step of the way, she's been there, and she's provided hope for me and our family, and she is just our miracle.
What's your middle name?
Her middle name is, so it's Marlo Donna from my mom, who's here, and Hope. Yeah, she has 2 names because she's extra special.
How sick were you with the chemo? I mean, do you have to limit the chemo because she's pregnant and you worry about the baby becoming undernourished now?
I had horrible morning sickness before I was diagnosed, so I know Dr. Carlton was pretty concerned that I was going to be pretty sensitive to the chemo. But miraculously, I was great during chemo. I mean, I had joint pain. Obviously, I lost my hair, but no nausea, no mouth sores. Yeah, it's pretty amazing. I think almost the pregnancy protected me in a crazy way.
I mean, part of it is that medical oncology has come such a long way. It used to be, yes, the stereotype, you were going to be bald and you're going to be throwing up. It was true. And now, even being bald is not always true. We can use a cold cap and help prevent hair loss. But we have such good medications to prevent nausea now. So instead of chemotherapy being just bona fide torture, we can do a lot to support people, and that makes a real difference for all people. But especially, it was critical that she maintain good nutrition for the baby and her, so we were able to really get her through pretty well. And we work very closely with patients, and I think that it's actually now rare that people are throwing up because we have such good medication, which is nice because it used to be brutal offering people chemo.
I say I'm cancer-free. September 19th was a year cancer-free. I refuse to ever write on paper that I had cancer. It's gone from our lives forever. So that's what I mean, I don't know the technical terms, but that's what I say. I mean, I don't know if you can speak, but yeah.
Does this always work? You always have this happen?
Nothing's 100%.
But one of the good things about breast cancer, if you have to have something good, is that breast cancer is so treatable. So if you take 85% of all women who get diagnosed with breast cancer, they will die of something else. So breast cancer is treatable and curable. But no matter what you have, nothing's 100%. So we know, I mean, that's where, you know, our heart is in our mouth, because we're always hoping for the best, but sometimes it doesn't happen. So we know that the odds are with us because it's a very treatable cancer and we have such good treatment. So we know we have good options, and Jen and I both know that we don't have a guarantee, but we're in it together. We monitor. It's the key thing is that, and it's not even about scans, it's about paying attention. Jen pays attention to her body and what she's feeling, and I pay attention to Jen. And together, we're going to keep you cancer-free.
It's not the first case you had of this here.
No, I mean, I think every medical oncologist has had, you know, one or many. The longer you practice, the more you'll have. So I've had women, diagnosed first trimester, second, third. I've had women diagnosed sort of right as they're delivering and, you know, going through having a newborn and chemotherapy. But, you know, we're tough. Women are tough. We're going to do what we have to do to be a wife and mother and to go on living our lives. So it is all doable, but it does require the team, because you can get through it with your family, and all that family is over there. You're seeing, you know, the star here at the center, but it is incredible, you know, how this has been a wonderful family to work with, because there's such support, and it is inspiring when we see that.
And where are you guys from?
We're from Floral Park. Yeah.
What are your ages now?
32. 32, yeah.
The baby's how old?
18 months.
Today.
Yeah. Yeah. Thank you. I know. I
gave up my jewels for her. I'll do any grandma tricks I know to. I'm not worried. I'm not worried.
I was going to get my mom to say something, but she might be too emotional.
Thank you so much.
Yes, thank you.
You're amazing.
Thank you.